Hi my beautiful people, welcome back to my channel. Today I am going to talk on hepatitis. So at the end of today's video, you will know what hepatitis is all about, the types, the signs and symptoms, management and treatment as the case may be. So if you've not subscribed, please just click on the subscribe button and also click on the notification bell because I'll be uploading more videos so that you always enjoy my channel. So what is hepatitis? That is the first question we have to know. Hepatitis is what? Inflammation of the liver. That is as simple as A, B, C, D. When you hear the word hepatitis, what should come to your mind is all about liver enlargement. It's the same thing with liver inflammation. Anything that will make your liver to be inflamed is hepatitis that always causes it. So we all know that liver is a vital organ that has a lot of functions. It helps to filter blood, it fights infection, it releases blood clotting factors that helps to control bleeding. And it also removes bacteria and dead red blood cells from the body. It helps to also store nutrients that provides energy when needed. And this liver also secretes bile. This bile, when it is being secreted, it will be stored in the gallbladder. So the essence of this bile is to what? To help in the digestion of fats. So you can see that liver has a lot of function in our body, so it's not an organ that should be joked with. We should all be conscious of this hepatitis because it causes more damage, mainly to the liver. So this hepatitis is a very deadly disease. Many people even have this hepatitis without even knowing. But today because we have two forms of this hepatitis. We have the one that is being caused by infectious agents and the one that is non-infectious. So today, the one that is called non-infectious agents is not what I'll be talking on today. Instead, I'll be talking on viral hepatitis. These are the ones that are being caused by virus. So that is where I'll be narrowing down my explanation today. Viral causing hepatitis. So we have different types of hepatitis. We have Hepatitis A, we have Hepatitis B, we have Hepatitis C, Hepatitis D, and Hepatitis E. We also have G and F, but those ones are not common. So I'll be talking on this A, B, C, D, and E. And all these 5 forms that I just mentioned now, they affect the liver. So all these forms of hepatitis too, they have different symptoms. Like Hepatitis A, they all show both the B, C, D, and E. They present the same symptoms, but when it comes to severity, it's not all of them that shows the same severity. And then there are general signs and symptoms of this hepatitis. Like, for instance, anyone that has this hepatitis virus will always present with this jaundice. What is jaundice? It's not only kids that suffers from jaundice, Adults also experience it. When you see someone's eyeball, this place that is whitish, to just be yellowish. If you look at the person's skin, it will look pale, yellowing of the skin. But as if you look very well, both the body, everywhere, you'll be seeing these yellow patches all over the skin. Then it's also presents with fever, tiredness, fatigue, muscle ache. It has abdominal pain, because this liver is situated somewhere around this place, so it always presents with abdominal pain. So that is why I said I have to come and explain this hepatitis, that you will not take any signs, any symptoms, you will not take it lightly. Whenever you just feel somehow, just walk to any facility near you, check all these things, make sure that everything is in check. Then the first one I'll be talking on is hepatitis A. This hepatitis A is always common in developing countries. This infection is also common in childhood, and it confers immunity too. for a very long time. How do you contract this hepatitis A? Its mode of transmission is mainly through orophycal means, which means through food and drink, eating contaminated food, dirty water, as the case may be. These are the easiest routes of transmission, especially people that feast outside. If you know that you are this type that eats outside, you have to check the hygiene of the place you always eat. There are some public places that you'll be buying food, the cooler will be open, and people will be talking at the same time as the woman is dishing out the meal. Put this meat, put this one, put this one. As they are talking, saliva, all these droplets will be contaminating that food. So if you are that type that eats outside, you have to be conscious of the environment where the food is being prepared, the neatness of the person in charge and how they wash their dishes, the kind of water they drink. You have to check all these things very well, because all these forms of hepatitis, they are so easy to contract, so easy, but when it comes to treating them, it's very challenging and something else. Then another mode of transmission of this hepatitis A is alcohol consumption. People that consume alcohol too much can also have this hepatitis A. Dirty environments, all these things, they are forms of contraction of this hepatitis A. And this hepatitis A does not cause chronic disease like other forms of hepatitis that we'll talk on later on. Then another mode of contraction of this hepatitis A is infected person preparing meal without proper washing of their hands. Someone that is already infected with this hepatitis A, cooking dishes for the family, for the public, maybe in an event, without proper washing his or her hands before helping out. Then another method of contraction is touching feet of contaminated person. Since this form of hepatitis, this hepatitis is common in children, it can easily be contracted if care is not taken. For instance, changing your baby's pampers, or maybe in rural areas where children will defecate in the environment, you have to use tissue paper to pick it up and go and dispose. So you have to be very careful not to touch feces anyhow. And when you come in contact with any, you have to wash your hand with soap and water, under running water, or someone helping you to pour that water. Then another thing about this hepatitis A is that it's less harmful. It's something that you can treat and the person will be okay. Then it doesn't need much treatment too. It goes on its own. Once your immunity is okay, your immune system can fight this hepatitis A, and you'll be okay. Then we'll be talking on the prevention of this hepatitis A. What are the prevention methods that we have to talk on? We have to wash our hands after using the toilet to prevent the spread. Then I jotted some other points here. We have hepatitis A vaccine too. This vaccine is also important, like in kids. When you give birth to your kids or your neighbors, people that have children around them, always encourage them to take this vaccine serious. Once that child is fully vaccinated within that first 1 year of after his or her birth, that child is covered. Then proper cooking before eating. Before you eat anything, make sure that you cook your food very well. Don't say that I want to eat this vegetable half done. In as much as you are trying to preserve the nutrients in that vegetable or whatever you are cooking, also ensure that at least you cooked it to an extent to done, not half done. Then another thing is eating your food while hot. A lot of us, we prefer cold food a lot. Food is good to eat while hot. If you have your food and you come back from work, you feel like you want to eat, just do justice by warming that food. It will help if there is any bacteria or whatever that have the ongoing during the process of storage. You can just warm it and heat it up before eating. You can eat it while cold immediately, but not prolonged cold food. It's not healthy at all. Then after changing your baby's diapers, like I said earlier, also wash your hands. Don't take chances. Then proper washing of vegetables and fruits. We buy fruits in the market. proper washing, like not just once. Wash in water that contains salt. Salt kills all forms of bacteria, viruses, parasites. With the aid of salt water, wash all your vegetables before sharing it among your kids. Then another thing is drinking clean water. Clean water is very important. In fact, most of the things we suffer from is as a result of dirty water. Even typhoid is as a result of dirty water. And we have soakaways around that contaminate our borehole and everything. So if you can boil your water before you drink, fine. If you can filter, fine. We have many things that can make your water to be clean. Water guide. Just do your best to make sure that the water that you and your family are drinking are just safe. That is for hepatitis A. Then another form of hepatitis I will be talking on is hepatitis B. This hepatitis B is also known as chronic hepatitis. This form of hepatitis takes time to cure, as you can't it's not something that medication can just take care of just like that. If you have a strong immunity, like I said before, it can fight against this virus that first time you're exposed to it. But if not taken care of by that immune system, it can prolong, and be chronic. And once it enters that chronic stage, you just have to manage it well. And it is one of the most, it is not even one of the most, it is the most deadly form of this viral hepatitis. So hepatitis B is also one of the leading cause of liver cancer. Then how does someone get this hepatitis B? It can easily be transmitted through mother to child transmission during childbirth. When an infected woman, is giving birth, if that woman is infected with hepatitis B and that woman did not attend the antenatal care as early as, if normal birthing process should take place and care is not taken, the mother can easily transmit this hepatitis B to an unborn child. Then another form of transmission is through sexual contact. This hepatitis is is highly infectious. This hepatitis B particularly is highly infectious, so you can easily contract it through body fluid, be it blood, urine, saliva, sweat. You can see that the mode of contraction is as plain. Once body fluid is involved, someone can easily get this hepatitis B. Even while sitting in a public transport, and you are sweating, and your next person sitting by you is also sweating. Is as easy as that. Somebody can easily, many people have even contracted this hepatitis B without even knowing how it happens. So that is why you have to be so conscious of this hepatitis B, and it is deadlier than HIV. This hepatitis B, it kills faster. Someone with HIV can live his or her normal lifespan, everything, but this hepatitis B, if not managed properly, it kills faster. So we have to be very conscious, people around us, how we render help. Maybe in an accident scene, we just see people in a pool of blood. As you are trying to help out, you have to be conscious. Check if you have cuts in your hand, because many people have contracted this hepatitis B without even knowing how it happened. So you don't just live your life just carelessly. Protect yourself, do your best to avoid this hepatitis B. Then another mode of transmission is through contaminated blood. There are some people that when they are in need of blood, they are being transfused in the hospital. But thank God for science today. Bloods are being screened thoroughly before transfusion. We check this hepatitis B, hepatitis C, HIV, syphilis. We screen blood thoroughly. But another thing is that some people that are in rural areas, the mission is just to save life. When a donor's blood is not being screened properly, someone can also contract this hepatitis B through blood transfusion. Then another body fluid is seminal fluid, like semen. When you are having sex, always if that person is not your partner and you don't know the person very well or you don't trust him, always ensure that you use barrier. Don't just allow someone you just met, to have intimacy with you without knowing the person's hepatitis B status. It's very important to always check out. It's not just HIV, because I've seen many partners, friends, people that are about to marry. Once they meet a friend, they will just be cautious of the genotype and HIV. We have other deadly viruses like this hepatitis B that needs to be checked before any other thing. Vaginal fluid as well. Infected lady can easily transmit this hepatitis B, to his or her to her boyfriend through vaginal fluid. Anything fluid, body fluid, they are all channels of transmission. Then another thing is sharp objects. If you are this type of person that draws tattoo or whatever, you have to have your own whatever sharp objects you are using. Don't just go there, use public sharp objects, even in your house, your roommates. Be careful of the razor blade you use to cut your nails. Anything sharp objects, just be very careful. Make sure that you are the one that opened it. If you are not sure, don't assume, don't use. Just get a new one to keep yourself safe. Then this hepatitis B is good to be conscious of it, because as a teenager, as a young person that has a bright future, you have to do your best to prevent all these things. Just do your best, because once one is infected, and it takes management for this hepatitis B. It's not something you can just say, let me take this medication and be fine. That is for the mode of transmission for hepatitis B. Then what are the preventable methods for this hepatitis B? It also has vaccine. That is the good thing about this hepatitis B. You can also get vaccinated even as a grown-up. If you walk into any health center, tell them that you want to get vaccinated against hepatitis B. It will go a long way to make that person immune against this hepatitis B. Then also ensure that your newborn, that they complete the vaccine within 24 hours. If you give birth, or your neighbors give birth, all these vaccines, they have time that they do take them. And when you miss issue, there are some vaccines that when you miss, you can't even administer that vaccine again to a newborn. So even if you weren't opportunity to give birth in an urban area, just do your best. Talk to your healthcare provider. How do I get my newborn vaccinated? Is there anywhere you can refer me to? Because some of these, we don't even inform all these women the importance of this vaccination. So it is very important. Then hard drugs. All these people that are always injecting hard drugs on the body, it's not good at all. It has a lot of risk. Even if you have to do that, always ensure that you are using new needles to do that. Don't use the one someone have used. Don't even assume this person is looking healthy, let me share this needle with this person. No, don't use someone's needles. Then another thing is to avoid multiple sexual partners. With the risk of everything out there, not only this hepatitis B, we have both the ones they've discovered and the ones they've not discovered. There is no benefit in having multiple sexual partners. If you have a boyfriend, if you are married, just stick to that person. Know the person's status. Both of you should be faithful to each other. Don't meet this person, because you can't tell the status. That is for sexual partners. Then we have talked on people that draw tattoo on their body. All these things are mode of transmission. Even you can also get this hepatitis B from blood transfusion too. Then another thing is that this hepatitis B, like I said before, is also a leading cause of liver disease. Even sharing spoons, all these things, sharing cups, like if you have your kids that are in boarding school, you have to teach them all this. Let them know. Let them not be in the name of being social with their friends, in the name of I don't want this person to see me like I'm avoiding her, or I'm avoiding to share things with her. Teach all these kids all these things. Use only your water bottle to drink water. Don't use another person's water bottle to drink water. All these things, Teach them, let them know, and give them reasons too. That is for hepatitis B. Then the next one I'll be talking on is hepatitis C. This hepatitis C is not easily transmitted as hepatitis B because it is not being secreted much in the body. Unlike hepatitis B, that one, is everywhere. It is being secreted in larger quantity. It is found in the seminal fluid, vaginal fluid, blood. It's just available everywhere. But this hepatitis C now is not easily transmitted. Even when one is exposed to it, your immune system can fight it and overcome it. That is for hepatitis C. It is also contaminated through blood, sharp objects, like I explained in hepatitis B. Then, this hepatitis C also can be seen in people with co-infection, like someone that has hepatitis B and HIV at the same time. That person is prone to hepatitis C. Then, sexual contacts, especially during menstrual period, is not safe too. It will also increase the person's chances of contracting this hepatitis C. Then, this one cannot be contracted through breast milk, through body contact, like I explained in hepatitis B. Like if you have someone sweating beside you, you cannot get this hepatitis C through it. And it cannot also be gotten through kissing, because some of these viruses, there are some places that they can be in larger quantity, but this hepatitis C cannot be found in saliva, cannot be found in breast milk, through body contact, sweat. It cannot be found in those body fluids. And with strong immunity, hepatitis C can be defeated by your immune system. Yeah, I noted it here also. The other way that you can prevent this hepatitis C is by eating immune boosting food. Maybe I'll make a video on this immune boosting food so that we'll know the foods that we can eat to boost our immunity. Because once the immune system is, functional, once it is working, you can easily overcome this all these viruses. It is when someone's immune system is low that any small thing that comes away, that person can easily get it just like that. Then see a physician as soon as possible. Whenever you run tests, like I would advise people to always check to run this test maybe yearly or once in 2 years. Once in a while, you go and check hepatitis B and C particularly. Just walk into any laboratory, tell them you want to screen your blood, you want to check for hepatitis B, hepatitis C, and other things too. But this hepatitis B and C mainly is good to check regularly, so that when you get this thing on time, it will be able to know how to go about it as easy as. Because when you waste time, when it has done more damage to your liver, it takes a lot of challenges to overcome it. Then there is no vaccine for hepatitis C yet. Like for hepatitis B, we have vaccine for it, but for this hepatitis C, there is no vaccine for hepatitis C. Then another one is hepatitis D. This one is also common among people with hepatitis B. When someone is infected with hepatitis B, that person can be exposed to hepatitis D. That is why I say that hepatitis B is good to be avoided. If there is a way you can do your best to avoid it, if you can avoid that one, all these other ones, your immune system can handle them. With treatments, you can be better. So it can be prevented once someone is vaccinated with hepatitis B. Have you seen the advantage of being vaccinated with that hepatitis B? Once you are vaccinated against hepatitis B virus, you don't have anything to worry about hepatitis D. So, according to World Health Organization, this hepatitis D has been reduced to the barest minimum because of what? Availability of this hepatitis B virus. So that is why hepatitis D is not that common. You don't hear it like the way hepatitis B is common because of the vaccine. Once you are vaccinated, you are good to go. Then the last but not the least is hepatitis E. This hepatitis E The mode of transmission is through dirty water, especially water that is contaminated with feces, like I explained in hepatitis A. The mode of contraction of hepatitis A and hepatitis E is through what? Oral fecal means, which means through contaminated food and drink. So if you can improve your hygiene, be conscious of what you eat, how neat it is, you don't have any problem with this hepatitis A, then it is also common in underdeveloped countries. Now when we talk of these underdeveloped countries, we are talking of where hygiene is still lacking, where people do anyhow, drink any water, eat any food. In developed countries, this hepatitis E is not common, and hepatitis E has vaccine produced too. From my research, I heard that they have a vaccine that is being produced in China, and it is only available over there. So they are the only people that have this hepatitis E vaccine. But the good thing is that this hepatitis E, it goes with time, without medication. Have you seen another advantage of having strong immune system? With immune system, you can overcome all these forms of hepatitis. And the prevention is just to make sure that you eat good food, good water, avoid ice block. You don't know the source of water. You know there are some people that buy ice block out there. They buy these ice blocks to maybe put in ordinary water. So don't just buy anyhow ice block, because you don't know the type of water they use in icing it. So I said I'll come and share everything about viral hepatitis with you, and I believe that if you've watched this video up to this point, that you've learned a lot. So don't keep it to yourself. Be your neighbor's keeper. Share this video to your younger ones. Share it to any mom out there. Share it with your brother. Watch it with many people, because you don't know who you save out there. You might be informed, you might know this before now, but there are some people that don't know this thing. And this hepatitis is so it's common, and people don't know about this. When they come to our lab and run tests, and you are telling them that you're hepatitis B positive, I feel for most of them, because they look so innocent. They'll be like, how come? How did I get it? You'll be hearing different questions. Even some of them, they kept themselves. How do you explain to people out there? Because they will just be seeing you as someone that is gallivanting from one person. And nobody cares about how you contracted this thing. Nobody cares. So that is why it's good to be conscious of everything that's happening around you. Just do your best, and I believe that as you are doing your best, God will continue to protect us. Thank you for watching. Please subscribe to my channel. If you want any video on health issues, you can drop it in the comment section. And don't forget to do what? To like. A massive thumbs up. Thanks for watching. See you next time. Bye.